what works and what doesn't work. What do you go to? Everybody's got this magic cure or this magic potion. Who do you go and see? What works and what doesn't work? You know, and I guess people ask me. I've often said word of mouth. Go to someone who's got a track record, who's got results. All right, and that's what I think is true in all of life. Your track record speaks volumes for how you work. So whether it be physio, chiro, and osteo, I don't really have any regard. It's really about, is their track record there, and are your treatments being progressed, and in the long term, do you have a sense of closure in terms of your treatment? It shouldn't be open-ended. All right? So that's our goal. That's my goal, is always permanent pain relief, always. And or to teach that person, to empower a person how to manage it themselves. All right, to free that person. Ultimately, I think that, you know, treatment is, you know, when you can't do something, you've lost your ability to do that. All right, so you've lost a bit of life in some ways. So really what treatment should be doing is empowering you, giving your life back in some way or form, so you can actually go back and do those things. That's really, but you know, drugs, we've heard a bit about drugs or medication over the past week in terms of what the reports were saying on the news. Heat or cold, when do you use that? Movement versus rest. Some people say, well, move, just move, don't rest. And that's sort of sometimes a bit contrary to, hang on a sec, I'm in pain. And I should, what sort of manual therapy might work? Is massage the right way to go? What about acupuncture? What about injections and surgery? You know, what works? Everybody's, you know. So, and yet, despite all of these interventions, if this is a scan I got from the ABS, the actual incidence of low back pain is not improving. You know, despite all of the things, all of our modern technology, all of standing desks and this and that, it hasn't changed. So you have to ask what's going on. All right. Today is about giving you some hope. All right, and I think ultimately why I admire you for coming along today is it takes a bit of a step outside your comfort zone to come to some stranger who's, you know, talking about an issue which is very personal, but hopefully out of what I'm talking a bit about today, and feel welcome to ask questions, because this is about you, not me, that you get a sense of hope, you get a sense of a strategy for yourself that I can do that, I can do that, all right? This is a question I think that you should all ask your treating practitioners. Why? Why? What's brought my back pain on, and why hasn't it got better?
Because you keep using your back.
Perfect.
The bones come.
You keep aggravating your problem. You keep aggravating your problem without knowing. And that's why I have an issue with just move. That's why I have an issue with just move, because what movement? If I just do movement which aggravates me, I'm going to be worse. If I've got a problem with my foot and I keep walking on it, I'm going to keep causing the problem. If I have a scab and I keep picking the scab off, it bleeds. It's going to keep happening. So the important thing to understand is, and I think we've lost this to a large extent in terms of our modern age, is listening to your body. What works and doesn't work. Every single person I'm treating, I'm testing my previous knowledge and trying to improve upon what I've done last time. So I'm taking all of my stuff that I've learned, but then bringing it forward to this point and retesting it. All right, and that's what this is a bit about today. This is what I've tried to refine over years of treating. Here's a system that works. All right. Okay, by continuing to do the same things and the same movements in the same ways that cause the problem, people are expecting to get better. See, what's really fascinating, and this is a really key point, is that 80 to 85% of people have back pain in their lives, but 90% of that, the research shows that 90% of those people who've got back pain, it's mechanical. Now, do you know what mechanical means? It's due to physical forces. It's due to physical forces. So,
Strain, you mean, or stress?
Yeah, so stresses, due to physical stress. So, premise, Your body will cause pain whenever you go above and beyond the body's ability to cope with those physical stresses, either abnormal stresses or excessive numbers of times you do that stress. All right? So if it's mechanical, it's behavioural. If you don't change your behaviour, you're never going to get better. The pattern, the habits of life that we just do naturally without thinking about because of the neural patterning in our brain that we've been doing from the year dot. And then our body's adaptation to that. So there's two things we need to get around. Okay, now, so what's the single biggest mistake that people make? They try and put band-aids on it, they try and mask it. All right, and we try and take our medication, and which, you know, may or may not work, depends upon what you think, but we become dependent upon it. That's the issue that I have, is that it then becomes something that you need to do, even if it doesn't work, because of this dependency. Physio, what we do should be about freeing you, should be about not dependent, make you independent. All right. The second thing people do is they try and ignore it. All right. And the third thing they try and do is to alter it, but they don't deal with the cause. So for me, when I'm treating people, two things. Yes, look at the source of the problem, but more importantly, look at the cause.